Rachel, and for me, this was a really amazing 2 days. As I mentioned at the start of the conference, my first health equity forum, and so great to hear so many perspectives and really dig into issues. A couple themes that I'm going to take away are trust. I think Yasmin said, we talked about it yesterday, we're going to talk about it again, and we're going to keep talking about it. It's clearly critical and foundational in terms of how we can move forward, and we have to dig in. That's a key thing I'm taking away from things. And the other thing is that I know that our last session was on clinical trials, and really better appreciating that it's very, very simplistic to think that we can just change our ability to recruit. We have to start a lot earlier, and we have to think a lot more broadly. So, Jenifer, I don't know if you had any thoughts.
Yeah, great. So Rachel thanked a whole bunch of folks, but I also wanted to thank the RDDC staff in particular, co-partnering with Global Genes. Without the staff, without the speakers, this conference definitely could not happen and it'd be as effective as it's been. And I wanted to thank actually the Sheridan staff. For those that are here in the room, you probably noticed that garbage has been moving really nicely and coffee has been flowing. So thank you all for keeping us in line these last couple of days. So in addition, right, so thank you for who's online and in this room. The conference also, we don't just need to talk to each other. So thank you for being here. And like you mentioned, as a first-time attendee, which is what I was last year, now you all can check that off your bucket list. And hopefully next year, bring a friend and come back again like some of your other colleagues have. So we no longer have first-timers anymore, right? So thank you everybody for attending. I think yesterday when I was thinking about what I was looking forward to, and I think about the purpose of this conference, it's about making a systemic difference. And so part of doing that is each of you count, each of you have a voice, and each of you have the ability to make a difference. And so maybe perhaps as we think about health equity in action, what can we do between now and next year to kind of make that difference, which I think is part of the theme that I've heard time and time again. And much like some of my background with the user experience, think about this as you're preparing your programs, and not just through the lens of clinical trials only, but through all the programs that you put together. Who is your audience, and do you have your audience as part of that working group to create the most effective and efficient program that you're looking to do? Another reflection I have is thinking about the energy in the room. What happened with the fellows from RDDC as they brought it and described some of the research that they have done? And then what about the grant recipients? I felt like there was a lot of energy in that room yesterday. So hopefully you may have seen that also online, but I thought that was fantastic. And the table talks, as Rachel mentioned, we take the survey seriously, and this year we decided to do table talks. And there were so many people in the room during table talks. It was incredible. So I think that that was something perhaps that we should really consider for next year, given the turnout, basically. So one last thing I want to share with you before I pass the mic over is, because this year's theme is equity in action, we've had quite a few folks talk about how to impact communities. Connie Lee said it yesterday when she thought about maybe you have to approach them individually. Sometimes you have to look at it through the lens of township. If we're going to make a systemic difference, you have to recognize the communities that you're trying to work with that might be a little bit different from the community that you're used to. And so what does that mean? And that also means very different for different generations. So if you are first generation here in America, perhaps you're more aligned with your culture from other places. If you've been in this country with many generations, I would consider you more of that Western European American mindset. So how are you working with these communities? And so really know that it's, again, the diaspora is very big and vast, so know those communities. So I'm excited to see what we have for next year, but hopefully you have a lot of takeaways here that you can make a difference in the communities that you want to serve.
That's great, Jenifer. And I heard you say several times, going back to that theme that, Mario Estevez kicked us off with, which is we need to be systemic change agents. And so kind of coming out of this, this meeting, let's take the conversation forward and continue these meaty and frankly difficult conversations about how we really transform things. I'm hoping that we can really work collaboratively toward this systemic change, and looking forward to seeing you all in Kansas City next year. Thank you.